Well, more than 50,000 people will die from colorectal cancer this year alone. Now, with that being said, there's a new push to end this public health problem. It is called the 80 by 18 initiative. And there are more than 900 organizations across the country that are committed to it. One of those, Licking Memorial Health Systems. So I would like to welcome CEO Rob Montagnes as well as Dr. Deanna Mullins to the show. Thank you both for being with me.
Good morning. It's great to be here.
So Rob, let's talk a little bit about the stats and about how Licking County is doing when we talk about this. So according to the American Cancer Society, they say colorectal cancer is the third most common cancer in both men and women. And when men and women are combined, it is the second most common cause of U.S. cancer deaths. So I don't feel like we get enough awareness about it in looking at those numbers. Is that the case?
I think there's no question. And first of all, it's great to be here on Sweeps Week because I know nothing gets ratings like colorectal cancer, and I'm sure this is really going to help us.
This is driving it home, right?
And I think, all kidding aside, that's why we're here.
Yeah.
The awareness, making the community, individuals throughout the community aware that it's a very treatable form of cancer, but it requires the screening and the diligence in a preventive way to really help those statistics get to where we want them to be. And I think through the education we do with our Speakers Bureau, certainly through our newsletters, and most importantly in working very closely with our primary care physicians who are so acutely aware of the importance of encouraging their patients through their primary care office visits to go and have their colonoscopies, their colorectal screenings. We can keep Dr. Mullins and the other oncologists who are outstanding, but not have them as busy taking care of the cancers, but preventing it more up front.
That's what we want to do, obviously, is prevention. So where does Licking County stand in all these stats?
I think we do fairly well relative to the cancer screening percentages. We're in the 60s, which is actually fairly good relative to national benchmarks. But obviously it's not where we want to be with respect to the goals that Dr. Mullins will speak to.
Yeah.
Getting to that 80% mark is something I think we can do, but we have work to do.
All right, so Dr. Mullins, you obviously work in oncology. Do you think that colorectal cancer is one of those cancers where people maybe don't know the symptoms, don't recognize it, and then therefore aren't really on top of things?
Yes, I think a lot of people believe that I'm going to have blood in my stool if I have colon cancer, and that is not always the case. A lot of times it can be microscopic, meaning you can't see the blood in the stool, which is usually the first tip-off that someone has something wrong with their colon. And so that's why screening is so important, because a lot of people don't have any symptoms.
So this 80 by 18 initiative, this is a great way to get the awareness out there. Tell us what it is, what you guys are trying to do.
So the National Colorectal Cancer Roundtable is a national coalition led by the American Cancer Society as well as the Centers for Disease Control and Prevention. And it is the goal is to bring together public, private, and voluntary organizations with the common goal of 80% of people over the age of 50 getting their colon cancer screening with colonoscopy. We know that colon cancer is decreased, and the deaths associated with colon cancer are significantly decreased if people get their colonoscopies, and we're just not high enough. We're not getting enough people getting them.
Do you think people just in general are nervous about doing that? Maybe they just think, well, I don't want to go through with that. It sounds, kind of scary.
Right.
But it's not.
Well, and I think that everyone knows a horror story. It's just like being pregnant, and you hear it. Everyone has their horror stories that they tell you. But it's you do have to do the prep and get the colon cleaned out. But the way I try to sell it to patients is, most of the time, it's 10 years before you need another one. And you get to breathe that sigh of relief for the next 10 years that, my risk is very low for having a colon cancer.
So that's it. Don't procrastinate, right? That's what you're telling folks, because it is not worth it to procrastinate.
It's not worth it. And it's heartbreaking as an oncologist to have a patient who's 53 or 54 who we know that if they had gotten their colonoscopy at the age of 50, as the national guidelines recommend, they probably wouldn't have the stage 4 diagnosis or the stage 3 diagnosis that they have. It's a very, very treatable cancer, a very curable cancer if caught early. And so, but by the time they hit my door, the cat's already out of the
Sometimes
bag.
it's too late. All right, and Rob, Licking County Health System is really promoting this in Licking County, so you want everybody to come on in and get this done.
Absolutely. I think speak to your family practice physician. Be very frank if you have concerns. I think they will be able to allay those fears, and once you go through it, most folks say clearly the prep is far worse than the test, but neither of them are bad, and they're certainly pleased that they had it done. And ultimately, it allows the physicians, whether it's the primary care or ultimately the oncologist, to better care for them. It just is something that we can do a lot better in improving the health of our community if folks are willing to have these tests, and we're willing to help them however we can.
All right, I want to thank you both for being with me today.
Thank you.